Anemia is a condition characterized by a decrease in the number of red blood cells, RBCs, or the hemoglobin concentration in the blood, leading to reduced oxygen transport to tissues. Here is an overview of the main types of anemia. Microcytic anemia. Definition: characterized by smaller than normal red blood cells, microcytes. Causes: iron deficiency anemia, most common cause. Results from insufficient iron, affecting hemoglobin synthesis. Thalassemia, genetic disorder leading to reduced production of globin chains. Chronic disease anemia, often associated with chronic infections or inflammation. Macrocytic anemia. Definition: characterized by larger than normal red blood cells, macrocytes. Causes: vitamin B12 deficiency, impairs DNA synthesis, often due to pernicious anemia or dietary deficiency. Folic acid deficiency, similar to B12 deficiency, affecting DNA synthesis. Alcoholism and liver disease can affect the production and size of RBCs. Normocytic anemia. Definition: characterized by normal-sized red blood cells but a reduced number of them. Causes: acute blood loss, sudden hemorrhage reduces RBC count. Chronic kidney disease, reduced erythropoietin production affects RBC production. Aplastic anemia, bone marrow failure leading to decreased production of RBCs, WBCs, and platelets. Hemolytic anemia. Definition: caused by the premature destruction of red blood cells. Causes: intrinsic factors, membrane defects, e.g., hereditary spherocytosis, enzyme deficiencies, e.g., G6PD deficiency. Extrinsic factors, autoimmune destruction, infections, e.g., malaria, or toxins. Sickle cell anemia. Definition: a genetic disorder where abnormal hemoglobin, HbS, leads to RBCs taking on a sickle shape, causing them to break down prematurely. Causes: inherited mutation in the HBB gene. Pernicious anemia. Definition: a type of macrocytic anemia caused by vitamin B12 deficiency due to a lack of intrinsic factor necessary for B12 absorption. Causes: autoimmune destruction of gastric parietal cells or postgastrectomy. Pathophysiology overview. Oxygen transport deficiency. All types of anemia lead to reduced oxygen delivery to tissues, causing symptoms like fatigue, pallor, and shortness of breath. Compensatory mechanisms: increased heart rate, respiratory rate, and erythropoietin production in response to hypoxia. Diagnosis: blood tests, complete blood count, CBC, reticulocyte count, and peripheral blood smear are used to identify the type and cause of anemia. Bone marrow examination, used in cases of unexplained anemia to assess bone marrow function. Management: iron supplementation, for iron deficiency anemia. Vitamin B12, folic acid, for macrocytic anemias. Erythropoiesis-stimulating agents, for anemia of chronic disease or chronic kidney disease. Transfusion, in severe cases or acute blood loss.